students, today we will be learning about pleomorphic adenoma. So pleomorphic means of different types. So it means of different types, and adenoma means it is obviously a tumor. So it is a tumor but it is non-cancerous type, and it may involve various glands like adrenal gland, parotid gland, parathyroid gland, or pituitary gland. So to remember these examples, we can take mobile app, right? So A stands for adrenal gland, P for parotid, and parathyroid. So pleomorphic adenoma occurs in the salivary gland, and mainly it occurs in 60% of pleomorphic adenoma occurs in the parotid gland, which is a type of salivary gland, and it rarely occurs in the submandibular gland. Now, firstly, we will classify the salivary gland. So, salivary glands are classified into two types, and pleomorphic is the benign type of tumor of the salivary gland. So, first example is pleomorphic adenoma in the benign type of tumor. So, to remember the examples, we can use the mnemonic MAAMS, that is MAMS. For malignant form and for benign form, we can use PWOO and BCD. So BCD, PO, BCD. So P stands for pleomorphic adenoma, and W stands for tumor of Warthin. Warthin. O stands for onychocytoma, and O is others, which is 10%. But for malignant form, others is only 2%. B stands for basal cell carcinoma, and here we have squamous cell carcinoma. And C stands for here, D is for ductules, and C is for maybe, yes, canalicular. Canalicular. Papilloma. Canalicular papilloma. Now coming to malignant form, first one is the myoepidermoid carcinoma. A stands for adenocarcinoma. Then we have adenocystic carcinoma. And then we have mixed type of carcinoma. Now for percentage, pleomorphic adenoma is 50%, Warthin is 10%, this one 50%, 10%, onychocytoma is 1%, others are 10%. Now this one is muco, not myo, mucoepidermoid. So this mucoepidermoid is 15%, adenocarcinoma is 10%, acinic is 5%. So this percentage can be learned. Now pleomorphic adenoma is named as carcinoma X pleomorphic adenoma. So carcinoma, X pleomorphic adenoma is its name. Now we'll come to gross features of the pleomorphic adenoma. So grossly, this tumor is less than 6 cm, well demarcated border with expulsion of inner region, right? Inner region that gives tongue shape to surrounding salivary glands. So it is also encapsulated. Now it is round or myxoid. So the meaning of myxoid is it is round. So these are the gross features. So imagining this we have, it is firstly rounded or circular, then it is encapsulated, then due to expulsion it gives the tongue shape, and border diameter is less than 6 cm. Diameter or length I'm not sure, but less than 6 cm. Well demarcated expulsion of inner region. So this was the some of the features, and they also have the chondroid regions. Now coming to the microscopic part. So microscopic part has basically two different types. They are epithelial and mesenchymal. Epithelial and mesenchymal. So mesenchymal is the product. It is the product of the myoepithelial cells. So what are included in the epithelial part? They are ducts, tubules, strands, sheets, acini. These are included in the epithelial part. Now, some features of the ducts are the ducts have the cuboid or columnar type of cells, and the myoepithelial cells are flat in nature. Now coming to the mesenchymal part, it stimulates the cartilage. And island of chondroid is found. Island of chondroid tissue is found here. Now coming to drawing part, right? So what we will see is that salivary glands will have basic structure like in acini form. These are the salivary glands, and epithelial cells may be arranged like this, or they may be arranged in a row. Like this, and there is pseudocartilage present in the matrix. These are the epithelial cells, which may be ductules, acini, tubules.